The StJoes Pediatric Dental Center is a dental home for many of the uninsured children in the state. We see about 23,000 patient visits a year in the Providence site, and we now have the Fatima Health Center in Pawtucket, which services about 6,000 or 7,000, and we recently opened the Johnston site last year.
We have a large volume of patients that come through from all sorts of backgrounds.
Typical patient would be somebody from the south side of Providence who probably does not speak English, who has been turned away from probably every other dental office that they've tried to go to, either because of lack of insurance or their type of insurance. We are
what I would say, the last resort for many of these children.
Unfortunately, they would be bouncing from dentist to dentist trying to find someone to take care of them.
We really have no place to refer a child. We are it.
Unfortunately, it's a really underserved population, and the great thing for us is that we get to go in there and we get to help all these kids.
If there's not another clinic like this, I don't think private practices would be able to take on this patient load.
So I feel that we really have to be able to service every condition, every medical problem that the children have, and coordinate their care with all our other specialists. It really is a process when the child comes in for same-day surgery. This is where the child is brought in just before the surgery. We do pre-admission testing here where we interview the parent, and then they move into the operating room. Today we have an 11-year-old autistic boy who is unable simply to sit in a chair and get the required x-rays and the treatment that he needs. So we're very fortunate to have this set up here where we're able to put the child to sleep and do all of the work that we need to do. We do over 700 operating room cases a year.
It's pretty shocking, actually. They keep track of our production and how much we actually do here, and I couldn't believe some of the numbers that we're putting up.
Does it stink sometimes getting paged at 3 o'clock in the morning? Absolutely. But once you get in there and you see that kid that needs you, that's in pain, that fell down and broke a tooth, or that mom that's nervous and doesn't know what's going on, and you have the knowledge and the skills to go in there and help them, and to make that kid feel better and to make that mom and dad feel better, you can't put a price on that. It's a good feeling.
I'm a single father. Recently got custody of my son at the age of 3.5. He came to me with terrible teeth. I was pretty much nervous, didn't know what to expect, but they talked me through with the programs and how it worked. So it gave me a little bit more confidence on how to handle things.
I'm here for 2 reasons. 1 is to help them, and 2 is to make them as comfortable as I can be. The last thing I want to do is make a kid feel uncomfortable.
We work really hard to make the patient feel very comfortable and never feel the need to have to not want to come back for the next visit.
It was last week when I got my first drawing from a child, a little girl named Zalma. It was great. It was really heartwarming. She had this little piece of paper in her hand and she handed it to me, and it was a picture of me, her, and her mom. So it was definitely, touching. Spending that time with her, spending that extra time, would allowed her to be much more comfortable, and I think that, that would carry on through future visits, hopefully.
If StJoes wasn't here, I'm really scared to think about what would happen to the children in this community.
When you work on children, you're able to impact them at a very early age and affect them for the rest of their life. There's no reason that a child can't grow up with the best dental care, regardless of their ability to pay, regardless of their insurance. So I really feel like we're able to guide that child to a lifetime of good oral health.
Thank you very much for the contributions. I'm grateful for it.
Thank you.